Why don't you tell us a little about that and then go ahead and begin with your testimony. And I was happy to join you last year as well as we honored some of the participants who give their service to this issue.
Yes. So Chairman Hall, committee members, and staff, thank you for inviting me during this Problem Gambling Awareness Month, where we raise an effort throughout the state of California to raise awareness of gambling disorder and the negative impact it has on the lives of many people here in California. My name is Terry Sucanelli, and I'm the chief of the Office of Problem Gambling within the California Department of Public Health. In 2003, the Office of Problem Gambling was established under Section 4369 of the Welfare and Institutions Code under the Department of Alcohol and Drug Programs. Effective with the passage of the 1314 Budget Act and associated legislation, Department of Alcohol and Drug Programs was eliminated as of July 1st, 2013. The governor's budget approved a transfer of Office of Problem Gambling to the California Department of Public Health, which has been a great fit for us. Office of Problem Gambling is now operating within the California Department of Public Health Center for Chronic Disease Prevention and Health Promotion. OPG is charged with delivering and providing quality statewide prevention and treatment services programs to address gambling disorder and related issues. The Office of Problem Gambling continues to meet our statutory mandate by administering a statewide prevention program. So we've administered the biggest prevalence study in the United States of America with over 7,000 respondents. We found that in California, our prevalence of problem and pathological gambling is 3.7%, which equates to about a little over 1 million individuals within the state of California. We operate 2 toll-free statewide helplines. One is 1-800-GAMBLER. I'm sure you've seen it or heard of it. And that helpline is operated in English and Spanish, and we use AT&T translation services in more than 200 languages to address the needs of our callers. 888-968-7888 is also the Asian language, in-language helpline for those from the Asian background. New to our 1-800-GAMBLER this year, we offer motivational text messaging. So this is where a caller can call the helpline, and to aid in their recovery, we offer weekly motivational text messages be sent to their phone just saying, continue on your recovery, you're doing great, find something healthy to do, go out and take a walk or work out today. So that's something that's new. It's offered over a 12-week period of time.
I need motivational text messaging too.
We can help you with that.
Great.
So it's we've had an overwhelmingly positive response from that. Clients have said, not only do we want to receive these text messages, but we want to talk to somebody over text, because what does everybody do now? Instead of pick up the phone and call, they text. So we now just started text support. So you can text the word support to the number 53342, and you can open up a dialogue with a helpline counselor that's at the 1-800-GAMBLER helpline and initiate and provide the same information that's provided to a caller. So we're really proud that we're moving with the technology to serve our clients. We continue to provide training and technical assistance to healthcare professionals, nonprofit organizations, educators, the gambling industry personnel, and law enforcement. The training is multicultural in background and provided in 22 different languages. And we offer an annual summit, which was just a couple of weeks ago in the Bay Area. And Senator Hall, you mentioned that you attended last year. We had about 185 attendees this year at the 2-day summit. Our prevention program services are administered to target vulnerable populations throughout the state, including youth and seniors and people from diverse multicultural backgrounds. Our public awareness campaign is multilingual for radio, billboards, cable TV PSAs, print, and digital marketing. Our multicultural website, www.problemgambling.ca.gov, offers information in 7 different languages. And we offer responsible gambling brochures and self-assessment tests online for gamblers. In the research department, we've done research on brief interventions, which was a self-help workbook. That workbook is now provided on our website in 21 different languages. We did some research on Call to Change, which is a telephone counseling program that we later added into our treatment program. And we've done research on manualized treatment for problem gamblers. We established what we call the OPG Advisory Committee, and that allows our stakeholders to provide input to our statewide strategic plan. We have a 5-year plan. We're on our second iteration of our 5-year plan, and we have stakeholders from the gambling industry, from state regulatory agencies, healthcare, mental health, veterans, educators, the recovery community, and service providers. Moving along from our prevention program, I would like to talk a couple of minutes about our California Gambling Education and Treatment Services, CalGETS, our treatment program. I provided some brochures to the sergeant, so hopefully you guys can get a brochure. It's the first of its kind in this state. Funding was allocated in 2008-09 to serve 4 regions: Sacramento, San Francisco, Los Angeles, and San Diego. In the very beginning, we focused on our workforce development. Back in 2009, there were only 22 counselors in the state of California who specialized in problem gambling treatment. To date, we've trained more than 500 mental health professionals in the state of California to provide care to problem gamblers and their affected loved ones. Currently, our CalGETS workforce is approximately 217 authorized providers throughout the state that offer services in 23 different languages or dialects. We established an ongoing support service system for our workforce with experienced supervisors offering clinical guidance to providers via group conference calls and advanced training. So the delivery of CalGETS, we tried to offer, our goal was to provide a step care approach for a continuum of services designed to help both the family member and the person who is negatively impacted by the family member's behavior. So we call those people affected individuals. Now our services provided are telephone counseling, where clients can make weekly appointments to speak to counselors and over the telephone. Outpatient counseling, where clients can make weekly appointments to speak to a counselor face-to-face. Group counseling, this is new for 2015, where our outpatient counselors can now provide groups to a group of gamblers or a group of affected individuals or even a group together to maybe deal with the financial issues that they're facing. We have intensive outpatient counseling, which is clients work with providers at a licensed treatment facility 3 hours per day, 3 times a week. We have 2 facilities now in Los Angeles and San Diego. And we also have 2 residential care facilities, which is our highest level of care, offering 30-day inpatient program where gamblers reside in a licensed facility and receive up to 15 hours of gambling-related counseling per week in Los Angeles and San Francisco. We established an oversight of the program to make sure that we're offering effective services, and we evaluate the program on an ongoing basis. We do compliance monitoring reviews of every provider within 2 years of billing for invoices. So as soon as they bill, they go on a list. We make sure that we go out and provide a site visit to ensure that they're following the policies and procedures. And after the first site visit, we have a risk factor criteria for subsequent visits. We ask the providers to evaluate our training events. We have the providers conduct an annual survey, so we're always evaluating and making changes needed. On the client end of it, we do follow-ups with the client after they leave treatment, 30 days, 90 days, and 365 days after they leave the program to get their feedback and how they're doing in recovery. All of our information is stored on an online data management system, providing outcomes for every single visit that a client sees a therapist, and it also provides for easing billing. As you can imagine, in the state of California, that's a lot of paper, and we're a paperless billing system. The UCLA Gambling Studies Program is our partner. They conduct research to ensure the delivery of effective services, and they've done research on manualized treatment for both the gambler and affected individuals, and most recently a mindfulness study in treating problem gamblers. I'm very proud to report that over the last 5 years, we've treated more than 7,600 clients in the state of California. And I'm open to any questions.
Thank you for your testimony today.
You're welcome.
And what a valuable service. Are there any comments from the senators? Any? I have just a question. How much of the funding for the Office of Problem Gambling is derived from the Special Distribution Fund versus other funding sources?
So our special distribution funding is about $8.2 million. We receive $120,000 from the California State Lottery. and we collect about 186,000 from the California card rooms.
And what problem gambling programs are funded by the SDF? So the money that you receive funds which portions of the programs that you carry out?
Both prevention and treatment. So prevention funding is about $3.2 million, and the funding for the treatment program is about $5 million.
And regionally, I know you say you treated 7,600
Yes.
folks this year. Regionally, are they from the majority from LA County, or do you not identify what area they're from?
We do identify. I don't have that information right here right now, but it's in our legislative report that's available online on our website, and we break down each region and the clients served from each region.
Would you say that the folks that you're supporting, that you're treating, did this problem occur because of our tribes and our card clubs, or other type of gambling problems or programs that they participate in?
When a client calls the helpline, or when a client comes into treatment, we ask those questions. So when a client calls the helpline, we say, what's your primary gambling preference? For the 4,100 individuals that called the helpline last year, tribal casinos were the primary first gambling preference, followed by card rooms and the lottery. In treatment, we ask what type of game is their primary game that they play. And over 60% of clients entering into treatment, their primary preference in games is slot machines. So I have statistics to say what our clients coming into our program are playing, what type of games they're playing, and where they're gambling.
Now, it is true, though, that the majority of those then calling in, they become addicted because of their love for gambling, and the majority, as you say, are from tribal casinos. But to support that, or to offset what you're doing, is it not a fact that a lot of the tribes have their own problem gaming programs as well?
From what I'm aware of, there's a difference between a responsible gambling program and a problem gambling treatment program. So I'm not aware of a treatment program outside the state of California that's funded by a tribe, or that's an individual tribal. They do responsible gaming, which is training their employees and detecting the signs and symptoms of problem gambling, maybe referring to our 1-800-GAMBLER helpline. But when it comes to handing off into treatment services, we have the only stepped care system in the state of California. There are other places that see problem gamblers, maybe recovery centers, and I'm not exactly sure how they're all funded.
Yeah, I guess my 10 cents is that, as I've toured some of the tribes and some of the card rooms with some of my members of GO, my conversations with a lot of them is that they provide referral services and things of that nature to folks with gambling problems and addictions, if you will. And I would think that would be a supportive mechanism for you, because if not for their referrals, some of those folks would not know where to go.
Absolutely. We work in partnership with all of the industry, with the lottery, with the tribes, with the card rooms, and with the horse racing board to provide them information to refer to our programs. So, that's our target demographic. The people who are gambling could be likely problem gamblers, could be affected by a problem gambler, and so we get that information out. We also track that information on the monthly calls as well. Where did you see the 1-800-GAMBLER? Many of the tribal casinos or card rooms have information about 1-800-GAMBLER posted in their venue.
So this year you supported 7,600. Last year
No, that's the whole program.
The whole program.
Not just in the year. Yearly, it's about between 1,800 to 2,000.
Have you seen a
annually.
peak?
No peak yet. It's directly related to our outreach and our advertising. The more we advertise, the more we conduct outreach. So it's kind of a fine balance because we only have so much funding. If we were to go out and really promote even more, then we would have people on waiting lists for a long time and they couldn't get into the program. So it's kind of a fine balance between going out and doing the outreach and promoting the program and getting clients into the program with the resources that we can handle.
Very good. Well, thank you for your testimony. Any other? You're good? Good. All right.
Good to see you all.
Thank you for your testimony. Thank you. Now we're going to open for public comments.
Good morning.
Good morning.
I'm here, Pilar Ñate Quintana, here on behalf of the Barona Band of Mission Indians. We are one of the 21 tribes that continue to pay into the Special Distribution Fund under the original state tribal compacts as forged in 1999. So we have particular interest in the Special Distribution Fund, and we very much appreciate the committee's time in investigating and evaluating what is going on with the fund. I won't elaborate too much because I think that Chairwoman Treppa hit the nail on the head in terms of the fact that when the SDF was originally forged in the context of the compacts, it was set on a path to be entirely sustainable. But by virtue of factors and actions taken by a prior administration, the whole system was kind of set onto a convoluted and sort of cattywampus path that has created where we are today. And there are unfortunate circumstances for Barona and its surrounding communities because the SDF is the source of local mitigation funds for such purposes as law enforcement and public safety and transportation improvements. And so we are very disappointed about the condition of the fund. We agree with Chairwoman Treppa that there is a fix in the form of redirection of some of the tribal general fund monies, and we hope that the committee continues to evaluate this, and we appreciate the time that you've taken today.
Thank you.
Mr. Chair and members, Monica Miller on behalf of the County of Santa Barbara and also today representing the California State Association of Counties. First of all, I want to thank you for all you've done for the SDF over the years. We've been very supportive and appreciate the restorations that you've done on our behalf.
Thank you.
Thank you. And counties are very supportive of stabilizing the SDF. It's a form of mitigation that we utilize on a very regular basis. And as you know, county budgets are in dire straits. Not a big surprise, but this is a fund that we very much support and would like to see the restoration and stabilization. Thank you.
Thank you for your testimony.
Good morning, Reverend James Butler from the California Coalition Against Gambling Expansion. I want to, as you consider the various uses for the funds and how those will be allocated, encourage more and more finances to helping and preventing problem and pathological gambling. As Ms. Cannoli noted, their numbers show that there's more than 1 million problem and pathological gamblers in California, and this year she said that they were able to assist some 1,800. The numbers are just catastrophic for the individual gambler and those affected individuals in that process. So as you look at the allocations, I hope that whatever mechanism you decide, as she says, if they have more revenue, they can treat more people. And I hope that you can put more into both the prevention and the treatment. Thank you very much.
Thank you for your testimony, Reverend. It's good to see you again. Yes.
Good morning, Mr. Chairman, members of the committee. My name is Les Marston. I'm an attorney that represents 12 gaming tribes in the state of California. I'm here today specifically on behalf of 2 tribes, the Chemehuevi Indian tribe of San Bernardino County and the Chicken Ranch Rancheria of Tuolumne County. Both of the tribes that I am representing here today are in favor of continuing the viability of the Revenue Sharing Trust Fund and the Special Distribution Fund. And the one point that I want to make is that if you go back to September of 1999, there was every tribe that was required to pay into the Revenue Sharing Trust Fund paid into the fund. It wasn't until Governor Schwarzenegger renegotiated compacts with certain tribes that required those tribes to instead of paying into the Revenue Sharing Trust Fund, diverted those funds away from the Revenue Sharing Trust Fund and pay them into the general fund. We then had the Ninth Circuit Court of Appeals rule that paying those monies into the general fund was an illegal tax. So it's appropriate, we believe, that since it was illegal for the state to divert those monies away from the Revenue Sharing Trust Fund and pay them into the general fund to begin with, that it's appropriate for the state legislature to prioritize those monies and make sure that those tribes that are paying into the general fund, that those funds be used to backfill the Revenue Sharing Trust Fund and the Special Distribution Fund. Thank you very much.
Thank you for your testimony.
Good morning, Chairman Hall and committee members. My name is Raymond C. Hitchcock. I'm of Miwok and Nishinon descent right here in Sacramento Valley. I am the chairman of Wilton Rancheria, which is just about 15 miles southeast of where we sit right now. I want to reiterate what Chairwoman Trepa talked about and the importance of the revenue sharing trust funds. We are one of the non-gaming tribes of the 73, and we rely heavily on that 1.1 million per year. It helps with our educational programs, student scholarships, elder programs, elder distributions, emergency situations, aid to tribal members, and to help our government run. It's a very important and viable source for us to continue operations. Thank you.
Thank you for your testimony.
Good morning, Chairman. Push the button? No, it's on. Good morning, Chairman Hall and members of the panel. My name is Charlie Banks Altacruz. I am a public affairs consultant to numerous tribes in the state. I just wanted to point out that there were several and are several compacts out there that would address in a considerable manner the shortfalls we're talking about, specifically the North Fork Rancheria compact that was put forward and passed by the legislature, and the Enterprise compact. The North Fork compact alone would have given nearly $322 million to the RSTF. That's $322 million. That's $16 million a year. That would have nearly halved the deficit alone for the RSTF. And that in combination with the Enterprise compact would have probably addressed the majority of this deficit. Similarly, the North Fork compact was allocating, had promised to allocate about $17 million to the RSDF. The huge contributions that these compacts were going to make to the state made them particularly popular, as you can imagine, to tribes throughout the state. Both compacts had the overwhelming support of the majority of the tribes, including official support from the Cat-G tribes who are represented by many tribes relying upon these funds. So I just wanted to point out that there are compacts out there that are we're floating around, are available to address this situation, and I hope that they can come to fruition. Thank you.
Thank you for your testimony. And finally.
Thank you, Chairman Frank Molina. On behalf of the San Ynez Banashumesh Indians, I just want to reiterate what's been said before, in particular Chairwoman Trepa's comments about the ability for the state to do something with the $330 million that are going to the general fund. I appreciate the work you've done over the many years, and as you know, we've received 50% of STF load mitigation grants over the last several years, mostly because of your work. Thank you. Thank you. And we did not receive any last year, and that's a promise that was made to the counties as testimony was provided. But we do think there's a fix, and we'll continue to work with committee and staff, and we appreciate the work that you're doing on the STF and RSTF.
Well, I appreciate it. Thank you for your testimony.
Hello, my name is Rhonda Pope, and I'm the chairwoman of Buena Vista Rancheria of Miwok Indians. I just want to echo some of the points that have already been made. The chairwoman that spoke earlier, she hit every point very eloquently. The general fund has been popping up multiple times here, and I think that we have to look at the actions of our previous administration and what domino effect that it has created, not only for our tribes, but for the state, for the local governments, and now for you. So I think that that point screams all across for everyone. I also believe that the SDF has another issue, and that issue is that I've read the audit reports, and so there's problems there as well. There needs to be more fiscal responsibility with the local governments. If you read those reports, you will see that many of the grants that are allocated do not have the proper documentation to justify the funding that's allocated to them, and that should not be allowed. I am an advocate for making sure that our tribes properly mitigate our impacts. However, I'm not an advocate of irresponsible management. So I think that that is something that you need to take into consideration. It's a very important issue. When you have over half of your grants under the SDF not being compliant, not meeting the requirements in 1 year, 2 year, 3 year, and over 5 years is unacceptable. And there needs to be, in the compact negotiations, there needs to be a mechanism in place that has that responsibility that goes all across the board. Because we can go and negotiate compacts, but then we're going to then have the other issues that fall between the cracks, and that is the fiscal responsibility. They're having a path between the state, the local governments, and having that clear, I'm running out of my words, but having a clear path so that you can identify that there's no gaps, because right now there's a lot of gaps, and that's an issue. The RSTF, my words are going to be this, is go back to the basics. Look at what IGRA was for. Do you remember what the meaning of IGRA was for? And that needs to be our biggest issue. We need to get back to protecting our tribes and our funds. This Tribal Nations Grant Fund, I completely disagree with. It's a shell. Why divert money to a fund when we can't even fulfill the fund that we have? That's just crazy to me. So I just think that we need to look at all of the issues that are all floating in the air and really pay close attention to them. And I urge that our states have responsible negotiating mechanisms in place with our tribes that don't just look at, small picture issues. We need to look at it all together, how it's going to affect all of our tribes. That's very important, and that is something that's happening right now. We have all of these compacts being negotiated, and we need to
the
stay
compacts are
focused.
negotiated by the governor.
Excuse me?
The compacts are negotiated
Yes,
by the governor.
I understand, but I still believe that the process has some flaws in it.
Okay.
Thank you very much.
All right. Thank you for your testimony. Thank you. And come on up. It's good to see you. And you'll be our last testimony for today. All right. Thanks for being here. It's good to see you again.
Good to see you, Chairman. Mary Ann McGovern, Vice Chair for North Fork Rancheria of Mono Indians. And I just want to say we are right now receiving the RSTF money, and I just wanted to kind of bring a little more personal use of what we do with the RSTF money. That RSTF money actually goes for our tribe to help support our ICWA program, that's Indian Child Welfare Act. We do not get enough money, federal dollars, to support that, to help our children going into the foster care programs. Yeah. It also helps with our burial for our tribal citizens. We're one of the largest tribes in California with 2,000.
How many?
2,000.
Yeah.
So it goes into burial. It goes into scholarship dollars for our students. We try to help everybody. We can't meet everything with what scholarship dollars we get from our self-government compact. So I just wanted you guys to know that this is what we do with that RSTF money. That's why it's so important to us, to our tribe, and to our local community. Thank you.
Thank you for being here. All right. Any comments from Senator Hydak? It's just me and you standing. All right. Having finished, I indicated that was the last testimony. Why don't we go ahead and adjourn? Right? All right. We stand adjourned. Thank you.